Good evening. This is for the week 4 journal entry. I know we were trying to do it on Kaltura. I tried 3 different times. It does not work. I have sent in a email to tech support and I sent an email to you as well. Okay, so getting started. I'm gonna keep this short for 4 minutes. Our chief complaint was that our patient is struggling in school, has an inability to sit still or focus on any activity, disrupting class, inability to complete homework or any type of schoolwork or any given task at school. So present illness is history of present illness. Patient is a 12-year-old African-American male that presents for psychiatric evaluation due to ongoing difficulties with attention, focus, and academic performance, which are pretty consistent with concerns of ADD. But according to both the parents who are school teachers themselves, he has trouble staying focused on tasks, easily distractible, and often forgets assignments or fails to complete homework. He sounds like me. And teachers have expressed concerns regarding his inattention and frequent daydreaming during class. I don't have that problem. I can't barely get any sleep. Despite academic struggles, the patient sleeps well, averages about 8 to 9 hours per night, which is good, and has a good appetite. He denies symptoms of sadness, anxiety, or any peer group pressures. No, their parents haven't really reported any poor impulse choices, but then again, he has 2 older siblings who are older by at least 3 years. So the parents have a 15-year-old and an 18-year-old. So, and they're both good students. They're both basketball players. One of his elder brothers actually got selected for Purdue as well. So family is very supportive. But they are concerned that his academic performance is going to affect his self-esteem. No history of psychiatric hospitalizations, trauma, or substance use, and he's not currently on any medications. He's never been on any medications. Vital signs were blood pressure 110/68, heart rate 78, temperature 98.4, respiratory rate 16. He's about 4'11", 90 pounds. BMI was about 18.1, which is really good. He's on, if you take it from the FNP side, he is on the higher end of compared to his peers. Appearances, he's well groomed, age appropriate. He was attentive during the interview with occasional fidgeting, shaking his leg and, just playing with his fingers, sometimes tapping on the table. His mood was good. He said it's okay. Affect was bright and appropriate. Speech was normal, rate and tone. Very goal-oriented. He understood why he was here. For a 12-year-old, very good insight and judgment. Understood that he might need medicine or therapy, and he understood that he had a hard time controlling his impulses to misbehave. We did the Vanderbilt ADHD diagnostic parent and teacher scales, which the results came back couple of weeks after we did this assessment. So attention deficit hyperactivity disorder, predominantly inattentive presentation. Differential diagnosis we said was conduct disorder, but and we'll discuss that later, I guess. Academic difficulty secondary to attentional deficits. No evidence of any type of mood disorder, anxiety disorder at this time. Further evaluation, we're waiting on teachers, school reports, the IEP 504, and we discussed treatment options with the parents for methylphenidate, Concerta, or any amphetamines, non-stimulants like Strattera. Family said that they would consider behavioral interventions before initiating medication. They would like to do behavioral therapy. So we did executive functioning coaching and academic skills training. Recommendations for classroom were preferential seating, extended test time, and for parents, we said maybe if he's interested in something else. We gave a pretty good example of Michael Phelps, how he was interested in mathematics, but he's also interested in swimming. So his mother made it about swimming, and swimming while he was doing his math, and he was able to focus. We gave them pretty good examples. So he's to return to us in 4 weeks for a follow-up. We would do his assessment scores and assessment treatment plan. We'll monitor for any emerging symptoms of anxiety, depression, or any social concerns, and also follow up with the therapist at that time to see if we can do anything else for this patient. Thank you. Hopefully we get to return back to the same patient.